So we were looking at, people who had these high levels of anxiety and anger and depression and seeing if we could help with that. And our very first study, we were really surprised at the magnitude of the effect. Like people's, depression and distress and anxiety was going down by about 65% just over these 8 weeks, right? We focused in on some of the specific problems people have, like sleep disturbance. So insomnia is so common in cancer survivors. And we wanted to see if this kind of approach could help with that. And it turns out it can. It doesn't resolve the insomnia right immediately, but 3 months later, most people were doing a lot better with their sleep. So mindfulness is really kind of a popular therapeutic approach. Over the last 15 or so years, it's becoming pretty mainstream. So really, just in case your viewers aren't familiar with it, I'll just sort of introduce what mindfulness is. And it's just this idea of being awake and aware in the present moment, rather than where our mind often is, which is sort of dwelling on the past, right? Saying, oh, why did this happen to me? Or if only I'd done this or that differently, things would be better. And, having regrets and getting sort of angry and depressed, right? When you ruminate in the past. It's very simple, but you'd be surprised at how difficult it is to integrate that into the treatment system, right? Because everything's so structured and this happens then and this happens then. And, so what we've been able to do across Canada, actually, as well as the whole province where I live in Alberta, is to now have it integrated into usual care so that when people come in every visit, it's just part of what they do with their nursing paperwork, is that they fill out this questionnaire about their distress and the common problems they're having. With the online version, we're trying to do it now, get people to start the online program right when they start chemotherapy treatment, so that we're trying to prevent some of the side effects that go with chemotherapy. So if they start doing the meditation and they do it while they're getting their chemotherapy infusions and they do it every day at home, can we prevent some of the fatigue and the insomnia and the pain and the nausea? So we're looking at that question. Just when we see in study after study that the benefits are quite consistent across a range of different outcomes. And, these are just looking at people who are just doing an introductory program. When we look at people who've practiced for many, many more years, you can just see that it's even more powerful.